Start with the record.
Okay, let me take it away. Okay, oh, right, lost your audio. Well, welcome everybody to our talk today on Project ECHO programs and how they might assist you in your research. My name is Matt Dugan, and I'm from the Northern New England Clinical Translational Research Network, or NNECTR. Gary mentioned quizzes earlier. That'll be on the test today. That's not our only acronym of the day. The important acronym today is ECHO. So what is an ECHO? Another pop quiz for you. ECHO stands for Extension for Community Healthcare Outcomes. It's an evidence-based interactive distance learning method developed by researchers at the University of New Mexico. It's a dry title, but it's a terrific concept. The ECHO model links teams of interdisciplinary specialists with primary care physicians to help address real-world issues. So how is today going to go? It's going to go like this. I'm going to introduce you to our three speakers in order: Dr. Mark Passanen, Dr. Sally Kraft, and Kelly Barnes. Please post your questions anytime, but save your raised hands until all three speakers have finished. They're going to all speak for 15 minutes. We're not going to put a clock on that, so speakers, if you could keep an eye on that, that would be great. And then if when all goes according to plan, we'll have about 10 minutes, maybe a little more for Q&A at the end. I suspect we'll have no shortage of questions at the end, but just in case we don't, I'm going to ask you now to show the speakers some love. We all know what it's like to present and wait for someone to ask a question, so be that person, be brave, hop in. You can even give them a pop quiz. Hey, what's ECHO stand for? All right, that's not entirely fair because no one remembers what it stands for. We just call them echoes. And I'm going to ask one thing more. If you're not sitting at home feasting on a plate of spaghetti and you've got your napkin tucked into your collar and sauce is splattering all over the place, if you keep your camera on, that's showing the love as well, because we all know what it's like to talk to a sea of initials. It's lovely to see faces. All right, so without further ado, it's my pleasure to ask Dr. Mark Passanen to kick us off. Dr. Passanen is an associate professor of medicine in the Larner College of Medicine at the University of Vermont. Welcome, Dr. Passanen.
Great. I'm so excited to be here. I am coming to you live, I said, from a barn. So what could be better for Northern New England folks? And hopefully my Wi-Fi hangs out. But it's really, I'm also excited both to present what we do and to learn what our others are doing as we think about expansion. So I've been a primary care doc at UVM since the mid-90s and been very interested in education. I serve as the program director for a medicine residency. And I went away to New Zealand for a while, and I came back and became very interested in how we better educate our rural docs and how we actually created a sense of community was really what I was interested in, because I felt very detached from much of the rest of Vermont as, you know, an academic primary care doc in Burlington, Vermont. And so along the way, one of my passions was really around chronic pain and opiate prescribing. And I'd learned a lot when I was in New Zealand about how different places might approach that differently, and became aware of the ECHO programs, of course, through the New England Journal and a bunch of other ways where they were starting to do a lot of education. And it was clear they were creating networks of docs to help them feel more comfortable in the management of chronic pain. So that's actually what got me interested in the ECHO format. Of course, it was super cool. It was Zoom, which is less of a draw to folks now and maybe a slight detractor. But at the time, this idea of being able to connect with people and not have to drive across the state and meet with small numbers of people and really start developing expertise was really attractive to me. So that's how I got into the business in about 2017, went to New Mexico, did the training on how one would run an ECHO, participated in a bunch of ECHOs, and then came back. And over the last 5 6 years, we've really tried to figure out in what ways we can serve our populations the best. Now, I'll say, and I warned our other speakers of this, we have not turned a lot of that into scholarship yet. I do a lot of this work with Charlie McLean, that I know many of you know, who's really been a more active researcher than me. I've really been a clinician educator and have really rolled into directing the ECHOs, but are very interested in how we can start to think about this in a more broader sense. And so as time has gone on, we've covered lots of areas from chronic pain to heavy dives into mental health, diabetes, tick-borne disease. But we've also started to think about the format, and happy to go into that in more details if folks want to hear more about the format, but to do things like connecting our school nurses and giving them ways to educate school nursing around common topics for school nurses. We did an echo with the judges of Vermont, where we learned a lot about interacting with the judges around helping them understand the substance use crisis, which they were seeing every day, but give a medical vantage point. So as we've gone forward, I think our next big areas of growth have been really trying to connect with the state in more and more deliberate ways to line up what we're trying to do at the state level. And one of the things that's been interesting and relevant to this group is the state is very interested in us collecting more data than we tend to collect from our normal clinical echoes. So we are actually in the process of expanding around cancer survivorship, around chronic obstructive lung disease, and some other areas where we're actually hoping to partner with the state to start collecting more information and hopefully turning that into more research. So that is, actually it's sort of where we're at right now. We just will finish up a series on mental health. As I've said, we're doing a 3-year series where we're trying to do more deep dive into some of the various areas around mental health. But it's really been fun to get to know people and develop relationships with providers across the spectrum, across our state. We have been pretty much focused on Vermont. Most of our work, since some of it is funded by the state of Vermont, so we have definitely focused, but also been interested in how we start connecting with people across the region and other areas that Charlie has really been instrumental in helping me, start to understand. And one of the reasons I'm excited to be here today. And so that's, I think, probably the big, 30,000-foot overview. I think the only other thing I'll say is there's really very limited limits to what you can accomplish with Echo. You can be doing QI projects with folks. We've worked on some of those where where the topics really the projects, not the patients. And that's how we kind of came at it from the judges' vantage point. We're just really trying to think about systems and process. So there's a really great opportunity to get a broad group of people engaged, involved, and to work going forward. So I think you sort of pull people in with the clinical piece, and then know that you have folks who you have relationships with. So that's sort of where I see us at. I'm very interested to see how it's been operating in our other northern New England states, and I may leave it at that, and say what questions come up and leave time for that, because I'm more interested in what would be helpful for the group to know than me guessing what would be helpful for you to know. So.
Okay, well, thank you, Dr. Passon. And that it certainly keeps us on track for time, doesn't it?
Yeah.
All right, so second in line, but not second in mind, Dr. Sally Kraft, MD, MPH, is the Population Health Officer for the Dartmouth Health System, where she leads a multidisciplinary team dedicated to improving the health and health equity of populations. She's an assistant professor of medicine at the Geisel School of Medicine and assistant professor of health at the Dartmouth Institute for Health Policy and Clinical Practice. Welcome, Dr. Kraft.
Great. Thank you very much. Let me go ahead and share some slides. You guys are able to see those slides, okay? Is that a yes? Okay,
Yes, they're just not in presenter mode. There you go, perfect.
All right, great. So I'm already a little bit set off because I don't have a cool barn background. That's like the coolest background I've ever seen. But I will do my best to try to make up with some pictures on the screen here. Dartmouth Health, you guys all know Dartmouth Health. I bring this forward because not only are we a big health system in the state of New Hampshire, but we also provide a lot of health for the population of Vermont. And we have really focused our ECHO program on being extremely broad. I was interested, Mark, to hear you say that you've really been focused more on Vermont. We've done a few things that have been focused in New Hampshire, but really our intent has been very, very broad. Our Project ECHO program, we started in 2019, August of 2019. The ECHO program lives in amongst our team, my team in population health. And we really have developed this program to share knowledge in order to improve the health and the health equity of patients and communities. Our team is very intentional in the way we work, and I always show the Castrucci and Auerbach's schematic of downstream, midstream, and upstream. Actually have a prettier picture that looks like a real New England stream. But we really work with intentionality at the clinic level, focusing on how do we adjust clinical processes to meet the true health needs of individuals. Midstream, how do we connect our patients to community resources? We run a community health worker program and have developed a community paramedicine program, work in tandem with the community nurse program. Really, how do we develop and build resources in the community? We also do our community health improvement plan and community health needs assessment. And then more and more focusing on getting upstream, really upstream, talking about the political determinants of health and the real social drivers of health in contrast to health-related social needs. So we can talk more about that later. Basically, we developed our ECHO program that reflects really this intentionality of working clinic, community, and then regional. As I said, we launched in August of 2019. We've produced 54 ECHO courses to date and have 4 new courses that will be launching in the next couple of weeks. Each of our courses typically lasts somewhere between 6 to 12 sessions. And this is what I think distinguishes us from other ECHO programs. More than half of our courses have been community focused in contrast the traditional ECHO clinical course. We've done plenty of clinical courses, much like what Mark was talking about. We've done courses for pain, palliative care, COVID, mental health, substance use, integrative medicine, HIV, et cetera, et cetera. But what I really am excited about have been the courses that we've developed thinking about that 80% component of what creates health. 10 courses that have been developed with primarily working in partnership with our schools, courses for community health workers, courses for employers. That was particularly important during COVID, but we've also hosted a number of employer-focused ECHOs on how do you support people in the workplace who have mental health disease or substance use disorders. One of our most exciting courses was related to town health officers and how do we support them as they work with a particular problem, which was hoarding and people living in squalor. And then a whole number of courses that have been very broad, vaccine confidence, youth support, and probably what I think is our most exciting course, which is the political determinants of health. And I'll spend a little bit of time talking about that at the end. Our reach, we've had about 6,300 people register for our courses. I don't know how many are unique, but those are the registrants total. We average about 48 to 50 people a session, and we've awarded over 3,000 continuing education units since April of 2024. This map shows you the reach. You can see the little dots are where people are registered from for our courses. Obviously very, very, very intense in the New England area. But we always enjoy seeing where people are registered from and signing in from, and it really has been international. I keep joking that I think those are just people who know us and have been and they're off on vacation. But regardless, it really has been an international reach. We have a very lean team, particularly in contrast to other teams that I've seen, and given the fact that we've produced about 55 courses in just the last 5 years. We have a product manager who she says she's 1.0, but truthfully, she's doing a number of other programs, including our e-consult program. So she spends most of her time doing Echo, but does do other duties as well. We have several coordinators. This 1.0 FTE is spread across several different people. I think this has been key to our success, is to have a dedicated medical education director, estimated time of 0.3 FTE. That person, interestingly, is a person who's retired from her clinical practice and continues to have her faculty position over at Geisel, the Dartmouth School of Medicine. But she's really able to dedicate the time to making sure that the courses that are produced are really high quality, high educational value courses. Business manager, and then this is me, executive oversight. We perform evaluation at the end of every before and after our courses. And again, we can spend more time on this. This is just a very, very high level view of the results of our evaluation. What we do is, for each learning objective in the course, our pre-survey includes a series of questions that will say, how confident are you? And then fill in that learning objective. So each learning objective gets that pre-question. And then at the end of the course, we ask the participants, how confident are you? Again, fill in your learning objective. And you can see this is pooled results aggregated across all the surveys that we've done. And you can see that on average, confidence level goes from 50% before the course and up to 87% after the course. All the criticisms of pre-post evaluations hold here, but it is very hard to measure the impact of an echo, and I think we're doing the best that we can. And I'll be interested to hear from my colleagues if they have better ideas. Mark, I was really intrigued with your comment about how do you create community, and we ask that very question on all of our evaluations. 94% of the people who participate and attend one of our echoes, 94% agree or strongly agree with this statement. As a result of participating in this echo, I feel a decreased sense of professional isolation. I think that in and of itself is worth an enormous amount of value. So I'm proud of that. I'll take just 1 minute to talk about what I think is probably our most innovative echo that we've produced, and then I'll summarize and end. In 2022, we initiated our first cohort, our first echo course termed The Political Determinants of Health. We are currently just finishing up our last cohort of, again, the same name, PDOH, or Political Determinants of Health. This course was developed in response to the fact that we really identify that state governments and state policy are probably going to have more impact on population health in the future than ever before. We see that essentially dissolution of the impact from a federal standpoint and the growing influence at the level of the state policy. And what we did is we brought together a diverse group of stakeholders across the state, advocacy groups, public health groups, medical society, new futures. These are diverse, our fiscal policy colleagues, folks who do the studies and actually create the data for us to make informed decisions at a state level across a broad, diverse set of subject materials. And we brought that group together and we said, what's ahead of us? What's coming through the state legislature? And what should we really be focusing on? Our government relations team partners with our population health team to produce this. And what you see on the slide ahead of you is just the list of the 10 topics that we covered in 2023. And every year, those topics change somewhat. We, for example, this year, we have spent a bit of time talking about gender affirming care and the barrage, the onslaught of proposed legislation to really take away from healthcare providers the opportunity to provide the best care for the individual in front of them. We've talked a lot about reproductive rights, et cetera, et cetera. So this course combines not only what policies are going to impact us as healthcare providers, but also what are the broader policies that are being considered that will impact those social drivers of health: access to childcare, access to affordable housing, transportation systems in the state of New Hampshire. This particular ECHO is actually focused on New Hampshire. My dream is to replicate this format and to do a train the trainer program so that other ECHO hubs across the United States can stand up their own political determinants of health course, a Vermont political determinants of health ECHO, a Maine political determinants of health ECHO, et cetera, et cetera. And we're hoping to find a willing sponsor to help us take this, disseminate at a national level. Have not found that person yet. We are in discussion. So I'll close by saying what we're particularly proud of in our program. We're really proud of our commitment to bring clinical and community partners together. We really live and breathe the fact that 20% of health is probably determined by our clinical care, 80% by the conditions in which we work, live, and play. And we work constantly to bring that upstream, midstream, and downstream together. Our team, our ECHOs are all team-based, focused for clinical care ECHOs. And we, from the very first ECHO we ever produced, we committed to including people with lived experience on every single phase of the ECHO, from planning to evaluation and reviewing data. So I truly believe this is a shining example of co-production. We pay all of our community experts. We actually offer compensation to everyone. We encourage people who don't need the compensation to turn it down. Our Dartmouth Health faculty who participate generally are not paid for their participation, although we do offer it. But we pay all of our community members who are participating, whether in a planning team or on a panel or giving a presentation. We do offer compensation for that. We are lean, really efficient staffing, I believe, for our program. And we are committed to continuously trying to learn from surveys, from discussions with people who have participated, and really working on how do we continuously improve our program. So I will end with that and turn it over to you, Matt.
Well, that was certainly eye-opening for me. I bet that's going to prompt a bunch of questions from everybody. Thank you very much. So last but not least, Kelly Barnes joins us from Maine Health, where she serves as the program manager for Project ECHO in Maine Health. She's currently overseeing the 10 ECHO programs that Maine Health sponsors, including the one led by the NNECTR Professional Development Core leads or members, Dr. Kim Lubers and Dr. Yvette Emery. So welcome, Kelly.
Thank you. Thanks for having me. I do have a couple of slides I will share, but nowhere near the in-depth that we just saw, because we are still at kind of a newer program here. I'm gonna swap my, hopefully this never works out for me. Can you see my screen, but it's probably not in presenter mode.
Yes.
See if I can. Yeah. I will do that, or else I will just do it like this, because like I said, I only have a couple. So first I'll give you guys a map in case you haven't been to Maine recently. Maine is a very rural state, and which is what made Project Echo really something that we wanted to start here, because we wanted to reach as much. Our focus mainly has been on the state of Maine so far, although we are certainly looking for opportunities to branch out. But as you can see, these are all of the Maine Health affiliates in the state of Maine. And while Maine Health encompasses now 9 hospitals and quite a variety of outpatient clinics and specialty clinics across the state, they are still well housed in the southern part of the state. And there's a whole bunch of Maine above Waterville, Bangor area that needs some assistance, especially with having to travel, having patients having to travel down to Portland for a lot of the specialty care. So that's really why Project Echo started in Maine, was really to look at the clinical opportunities, that what we could do to help the rural physicians in the northern half of the state, but also our Maine Health affiliates as well, to help treat the patients where they are in their offices up in Presque Isle, so that they didn't have to come down to 6 hours down to Portland to see a specialist and have to wait months and months to get there. So Project Echo at Maine Health started back in 2017. I know I'm not expecting you to read this very fine print graphic, but just to kind of show you what is kind of the explosion of Echo since I've been here. I didn't start until 2021. So I came in and kind of as Echo was really taking off at Maine Health. Really, you talk about bare bones staffing. It's just myself and my senior program manager, Heather, who run the Echo program at Maine Health right now. So there's just 2 of us, and she's actually not full-time for Echo. So we have 1.5 FTE that we are using to run the Echo series. And we started with endocrinology. That was kind of organically started by Dr. Brodsky Wick in 2017 here at Maine Health, to try to help, again, get some knowledge out to our rural practitioners in Maine. And it caught on from there. And we've done 18 different programs so far. Many of our programs run, like, they don't have an end date, or we reassess every year to see if there is still need for the Echo series to continue. So endocrinology is still going. It's our longest running Echo. And then we have some that just run short amounts of time as well, and 6 to 12 months and then end. So it's quite a variety to kind of keep track of. Sometimes they take the summer off and then restart. So it's a mixed bag of what people are looking for. But just like at UVM, mostly clinical so far, and people are coming to us with, like, we meet with our primary care councils at Maine Health, and we meet with directors to say, what do the primary care physicians feel that they need in their offices, or vice versa, like what are the specialists seeing in their offices that they feel like, a primary care physician, if they have the knowledge, could provide this treatment in their office rather than having to do the referrals, because they often have really long lead times. So so we are, our newest one starting up in the fall will be on obesity. That will be just a 1-year Echo. Again, just kind of based on the needs of the community that we're seeing. The next slide, just kind of briefly just go through like what we offer. So right now, the website is up there too, and I can provide this slide or website to anyone who needs it. This is kind of a synopsis of what our website has. And it does have information there on registration. So we open it up. Most of our Echoes are for any and all who are interested in the state of Maine or beyond to northern New England. We are subject matter experts are very happy to have anybody and everyone join them. We just have a couple of Echoes series at the moment that are, because they're starting out, they wanted to run it through Maine Health providers first, and then they'll probably open it up later. But what I really wanted to focus on, and I'm so glad that Dr. Emery is here, is probably the one unique Echo that we have at Maine Health is our clinical research Echo. And that started, gosh, we're finishing our 3rd year of clinical research Echo. And the focus on that, for that Echo, rather than on a focus for clinical reasons, is to help the physicians, primary care physicians, or other physicians in the state to access resources and support for their own clinical research projects. And so we have a variety of different team members from our Maine Health Institute for Research on the call, as well as a lot of our affiliates in the University of Vermont attend as well. And it's a great place for burgeoning researchers to come and talk about ideas that they have for a project, or they've started a project and are kind of stuck and don't know how to continue working on the project, or don't know how to design it, don't know how to use an EMR, don't know how to put a budget together. And we have a whole series that's devoted to them to help them with their research projects. And I'll just, Yvette, do you want to say anything any more about kind of how it's gone the last couple of years? Is how you feel the research Echo turned out?
Yeah. So just as Kelly mentioned, that first year we piloted the clinical research Echo just at Maine Health, and we had just Maine Health didactic presenters. And then the second year, we brought in the University of Vermont, and with Kim Lubers as my partner in crime, we alternate the Echoes, and every other month, it will be a UVM faculty presenter versus a Maine Health faculty presenter. And I'm seeing some faces here. Dr. Peter Callis was one of our presenters, Jonathan Emery, Jennifer Holmes. Those are a lot of people that come to the Research Echo. And it's a great community building group, because aside from the didactic presentation that takes the first half an hour, the second half an hour is for someone who is struggling with their research project and wants to hear potential solutions, or roadblock breakers, if you will, from the group. And it's just a really nice chance to get to know each other and to see what everyone is doing, and to just come up with new ideas that might benefit your research from the others. I also see Don Gage, who's been a great contributor to the Clinical Research Echo. So yeah, a lot of the folks in here participate, and we're very thankful for that. We're on our 3rd year. This month will be our last presentation of the year. It's on research on special populations by Dr. Stein, followed by a case study from a UVM faculty. And then we'll pick it up for year 4 in September.
And I'll just kind of echo what Dr. Kraft said. We do evaluations. There's no great way, but we do the same pre and post surveys for our series on confidence in the subject matter, knowledge in the subject matter, rating, aside from just the usual ratings and stuff. It's not perfect, but it kind of gives people an idea that, which topics, especially people already came in at a really high knowledge level at. And so if they're going to continue the series, let's not hit that topic again. We already kind of did that, versus ones that even after the session has happened, if they're still not feeling really confident on it, then it's another trigger for the hub team to go back and say, look, we need to address this issue again. So lots of, that pre and post, we do it both pre and post the session itself, and then pre and post this series. If it's going to be a year-long series, we'll kind of assess everybody's general knowledge at the beginning and end. So certainly not perfect, but lots of anecdotal, vignettes and people coming back to us and saying how great it is to have a community of like-minded people to learn from, to see people from different parts of the state and different, if they're all participants are all, from different walks of life, physicians and APPs and social workers and RNs and all those people from all different parts of the state. So it's really great to have everybody's input when they're dealing with those clinical questions that they have problems with. So that's all. I'll stop here, and then you can, like I said, we said it earlier, ask questions so I don't want to ramble and have talk about things you don't want to know about.
Can I just throw in one other quick thing? Because I think your point about trying to be right for the audience is just, if folks haven't participated in ECHO, it's not a webinar. And I think that sometimes is a big source of confusion. It is an interaction. So there is usually or often a didactic part, and then there's a working part. And by bringing those situations that the participants in the ECHOs are bringing their own situations, it helps make sure that you're answering their questions or talking about the things about the topic. So it is helpful that interaction happens, and is really a good ECHO that happens. And in a less good ECHO, it is starting to feel more webinar-y. And so something to be cognizant of as you might think about how they get designed. That is one of the fundamental principles of ECHO that makes it a little bit funner to do.
Okay, that was wonderful from all three of you, and we also have a bunch of time. So we have no comments in the chat, which I know means you've all been waiting to throw those hands up. So let's go to our Q&A and have that kind of discussion that Dr. Passanen was just talking about. I used to be a teacher, so I can do those long, painful silences until somebody breaks. Megan, please go ahead.
Yeah, so I'm kind of cheating because I already asked this question and got an answer, but I can break the ice. Yeah, I was really interested in all of these presentations and kind of blown away from some of the successes that Sally Kraft mentioned through her ECHO program. We work closely just down the hall from us. So I was like, oh, that political determinants of health ECHO, that sounds incredibly interesting. You said it's wrapping up. Am I able to retrospectively participate and watch the recordings, maybe access some materials? And she said, Sally?
The ECHOs, you do have to register for them. They are all free. And we keep all of our ECHOs follow the very standard ECHO format that we all learned on at the University of New Mexico. Out of an hour session, we'll spend hopefully not more than 15 minutes. Sometimes it hits 20 minutes, but hopefully not more than 15 minutes in a didactic presentation. And then 45 minutes of discussion, case-based discussion, and I'll come back to that point. We put all of our didactic materials on a resource on a website, and if you Google Dartmouth Health ECHO, you can get all of the didactic materials from our prior courses and take a look at those. Those will be like the slides or any references. I want to say that, oh, thank you. So Megan Colgan, who is the secret sauce to the Dartmouth Health ECHO program, just put the website in the chat. I want to say one of the conundrums we have is this a good topic for an ECHO, or should this be a webinar? And I think that's something that really needs to be thought of as you get ready to propose a course. We use as a differentiator is, will you have a case study? And it's not for us. I would say, Megan will keep me honest, but I'd say at least 90% of the time, we will definitely have a case. And those cases may look really different for especially for these community based ECHOs. And when I say community based, anyone can join, but more focused on a community audience. So Sally, how would you do a case for the political determinants of health? We actually will take an actual bill that's making its way through the House or through the committees, and we'll do a deep dive into that bill. What are the implications of that bill? What will be the potential harm? What are the potential benefits? And we use those bills as the cases for the political determinants of health. But I do think that that's an important differentiator. Are you going to have a case or something like a case that can kick off the discussion?
Wonderful. Who's next? And thanks for answering that question, because I actually had that question too about how do you do a political echo? So wonderful.
Matt, can I just say a quick thing that I thought of as well through the other presentations? That is such an important thing to, to whether it's an echoable thing or not. And it is something that you learn very quickly when you run a series where it is very hard to imagine what the cases look like. And so you learn that one relatively quickly. But there are two fundamentally different types of echoes, and it came up in the conversation. And there are ones that are planning on going on in perpetuity and will go on for years. And that was actually the original echo model, was trying to create a community of people who started to be able to manage hepatitis C on their own and constantly had questions coming up and had sort of a network of folks. And so the original more longitudinal, not ending echoes were really very much about community building. And you've seen over the years a more short-term one-off, a COVID series, this series, a diabetes series. And so as people are thinking about how echo fits in, those are just two very different types of models with different endpoints and goals to think about. Both work fine in the echo model, but they have kind of different goals and different ways they play out. And so just something to be aware of if you're thinking about how echo would fit into your plans.
Wonderful. Who's next?
Hi,
that was good. No, go ahead, Sharon.
Hi, I'm Sharon Mallory from the Vermont Department of Health, and we've been working with UVM and Mark a bit to plan this survivorship echo for next year, cancer survivorship. And my question is related to that in a way. I'm just wondering if these 3 states have ever sort of like your individual echo programs, have they ever sort of like worked together or overlapped on a topic, because I'm pretty sure that some other states are working on these survivorship echoes, because it's something that the CDC is sort of offering and encouraging as an option, and through our funding for cancer, and just wondering how that works, or if that's ever worked, how, is it sharing of materials or topics, and just sort of to less duplication of resources. So it doesn't have to do just with the cancer, but like in general, has that worked before?
I will say there's lots of sharing of the topics and how a series might look, and much of that is there's a great sense of community. The challenge really of bigger and bigger groups is what your goal of avoiding it being a webinar and how many people you're interested in having on any single session. So just as at Dartmouth, I think our average is in the 40s, 50s, of people on any given Zoom, any given session. And more than that starts to feel like you're not creating community, but you're talking at folks, and you start having less and less people on camera, and it just starts to change. It doesn't mean it doesn't have value. It just has a different feel. And so our only reservation outside of funding and the responsibility to make sure we're serving Vermonters, since that's where we're funded out of, has been really not wanting too many people. And you do run a little bit into, when you get into resources, we run into that just in a Vermont Echo, where we'll start being, if we're too Chittenden County heavy. We'll be talking about the resources we have here that are of no great use to someone in a different part of the state to hear about. And so we have to be very conscious of that. So I think how, what information you're using to help people is, you have to have pretty good understanding of that. But we would love to do more like that. It's just a matter of numbers. You almost get more narrow, and then you want to spread your geography where, like the research echo, where it's a smaller number of people that might jump into that. And so it really makes sense to have a broader area of expertise and a broader community in it.
Aaron, I thought one of the things you were asking about is, do Maine, UVM, and Dartmouth coordinate their echoes? And we don't, although there may be more coordination going on than what I know. But I will tell you that in New Hampshire, there are 2 other echo hubs, 2 other groups that produce echoes, and we have attempted to coordinate with those groups so that we're not doing, mental health for the youth, both all 3 echo hubs doing a course at the same time. I think we've, I'd give us a B on how well we've done that. We actually did 1 echo together, which was a national echo that was sponsored. I don't know if you guys did it at UVM or Maine. It was sponsored out of the University of New Mexico, funded by ARC, for nursing homes during COVID. And it was a national echo, and it was, we partnered with our 2 other echo hubs in the state of New Hampshire to produce that echo so that each of us were providing some functionality of this echo and trying to keep the number of participants in each course down to a small number so we could really create that sense of community and safety to ask questions. It's funny there. I don't think there's a whole lot of economies to scale from organizing across with different echo hubs. At least that hasn't been my experience. I do think there's an opportunity for improving coordination and communication so that we're not all doing at the same time an echo on tick-borne diseases or cancer survivorship. I'm actually looking. We start our cancer survivorship echo in July of this year. So we probably could do a better job coordinating across the 3 academic groups.
Anyone have any thoughts on that or unrelated? Actually, I'm sorry, I should go to Sheila's question in the chat from several minutes ago. When will the list of topics/courses to be offered next academic year be available? I think it seems like we've touched on that peripherally. Anyway, but also how can we help you promote those, we at the NNECTR? Because boy, are these topics timely, as Sheila says.
Sheila, we will send you all of, are you the right person? We can send you all of the flyers every time we launch. We're launching a cancer survivorship, an oral health echo, sexually transmitted infections, an employer echo for how to keep your employees safe, productive, who have mental health or substance use disorders, an echo for librarians, rural librarians, which will launch on June 11th. And then our 4th course of palliative care echo in September. Megan Colgan, again, the secret sauce to our program, is going to take down your name and your email, and she'll send you all of our flyers.
Yep, and it means how most of ours are ongoing, but we have a Project Echo newsletter that I'm happy to maybe just add Matt to, or whoever wants to be on it. It's just a quarterly newsletter to let people know about what's been happening with the Maine Health Echoes programs. And we always announce there what new ones are coming out, which ones are ready. Majority of ours take the summer off, July and August, to do some curriculum development before they start back up again in September. So it's actually, the summer months are a great time if you're interested in starting one of the ongoing ones. Is a great time to launch. Anybody can check out our website to get more details about the ones that we offer, and there are links to the registration lists right there as well.
Yes, and we list, we do a very much smaller, we're a much smaller scale. I think we have about maybe a half of an FTE that goes to all of our echo stuff all together. Maybe it's 0.7. So we only do about 6 or 7 a year, and those are all on the AHEC website for UVM. But if you just did UVM Echo, you can see what we've done every year. It's where we keep all the old material. We do not record any of the case discussions, so you definitely don't get the full experience. If you were to listen to any of our recordings, you may just see our didactic information. We're very careful not to have the case discussions show up and be posted. So those are just live in real time. So, but the Vermont, if you just did Google UVM Echo, you would find all that. And we're in the process of finalizing the dates for both the fall and the spring right now. That will probably be done within the next 2 weeks.
Awesome. I'm wondering if we can't just put links on our NNECTR website resources page that would direct people to your sites. And that'd be very efficient and maybe helpful to you to have people direct more people in your direction. Because I love all the topics, and I think most of our members, we have over 700 members in the CTR, and so
yeah,
be a good way to get.
That would be great.
Yeah. Thank you.
We have 9 minutes left. And just like, well, when I used to be a teacher, of course, we're going to go the whole hour. All right, I'll get to my questions if nobody else.
Oh, Gary had his hand up.
Matt?
I'm sorry. Oh, you know, Gary, you're at the very top of my screen, so I didn't see your hand. Please go ahead.
That's okay. I got over it. So the topic of survivorship is key. Obviously, it's important with cancer, but with chronic disease in general. But the complementary problem that we have, the complementary responsibility, is prevention. And I think this is an area that could be very effectively developed into a series of echoes.
It is always on our list of what we're going to attack in the prevention space. And we usually have way more topics that we'd like to do in any given year than we actually get to based on the limited number. So one of my hopes and one of my motivations from this talk is, you know, seeing the expansion of echoes and into different communities and different topics is to keep pushing for us to have more support to broaden out what we're doing, because it's successful, it's popular, it's fun to do. So I couldn't agree more.
Could I jump in with just a thought? I started to panic when I was thinking about how the echo relates to research. And all of you, I'm sure, have already made the connections. But one of the things that I just want to highlight is, so I spent a lot of time trying to create infrastructure for community engaged research and partnerships. And you know that you guys all can teach me, and one of our big problems is that we don't engage communities far enough or early enough in the research process. And I would just highlight that this is it's essentially a real-time listening session to what is important to communities. So while we will host a topic on oral health, that one starts on June 10th. If you drop in on these as a researcher, if you drop in on these echoes and your research has anything to do with oral health or infrastructure system design for prevention, there's a good tie-in to the last question. The echoes give you a chance to hear directly from the community. And if you work with the person who's doing the echo, you may be able to use the chat function for a poll. During COVID, we had in real time, we knew exactly what our OB/GYN docs needed, because we were running these echoes, huge echoes, many people coming, and we would say, what are the questions? And we'd have in real time. Everyone would enter in the chat what was their concern, and we would turn it around, and the next week we would create an echo that would address a common question. So as a researcher, this is a great way to say, you know, what's at the top of your mind, and hopefully move our research further upstream so that we're really addressing the questions that are real issues to our communities.
Yeah, that's a wonderful statement. All right, I'm going to jump in because I could keep us here well past one, but I won't. Okay, so very selfish question here. All right, panel, what's ECHO stand for? No, that's just me joking around. I do communication, and that's my thing, and that I do for the CTR. And one of the charges that I have, which is really important to me personally, as well as what's in my job description, is I need to take science and all the wonkiness and all the acronyms and all that and explain it to everybody, including other scientists. And I've learned a ton today about echoes, by the way. This has been so interesting. And if you're receiving the NNE CTR newsletter, I'm sure you're reading it cover to digital cover. That's my baby. It's one of my babies. If you're not, contact Sheila and she will put you on the list. And the reason that I mention that is that I can see a story on echoes in the future, and I would envision this story as having, you know, explaining to a general audience, because I always look at sort of the spillover, right? We'll take SpongeBob here, and we got the spillover. Everything that we do should get into the community eventually. This stuff is digital. It can be shared. I want everyday lay people to understand, to be able to peer beyond the acronyms and understand what we're actually doing. So there's not this really weird divide, which becomes a political divide nowadays, between the sort of intelligentsia, coastal elite sort of thing and everybody else. And so, number one, I may be contacting you to figure something out. And number two, I guess my real question is, what I would ask for that article, but how do you, your echoes are so broad. Some are definitely for people who are very clinical and very researchy, and others are for general people. How do you draw those lines and get the people you need to come and appear open and welcoming enough to so many different groups? Like, how do you handle that and yet keep things exclusive and discussion-y, as Dr. Passman was talking about earlier? Sorry for the long question, but
No, it's a great question. And I'll just say, I don't know the answer, because you don't always have the right groups, and you know, it's almost like any teaching exercise where you're around a broad range of expertise. But the very, very first question we ask when someone comes to us and says, hey, would you be interested in helping us get an echo off the ground, is, who's your audience? Like, it's the first question, because people have often, they just know, they want people to know stuff. And we have to really get them, like, are you trying to find providers? Are you trying to get whole offices to function in a different unit? Do we need an office there as a participant and all the players in an office when we're talking about a process change? And they often haven't thought of that. They've just identified a problem and a knowledge deficit. And so that's at least gets us going and gets a conversation about where we're going to start. I'd be curious how other folks approach that.
We have a very similar approach. I think because we do so much programming for the 80% that impacts your health, we use existing infrastructures. So we have lists of other associations and networks and coalitions, and we you build a personal relationship like we just did with Sheila. We'll just be sending flyers out as the courses come up. We also, almost all of our echoes, once you've registered, we have a listserv of people who have participated in our echoes. So we use our our registration information to also communicate. And we are constantly saying, who would be interested? Who would be interested? trying to use other networks.
And we've found with, especially with the continuing echoes, that it's often friends and colleagues that get their friends and colleagues to come because they know the value of echo and they get so much out of it themselves that they're the best ambassadors. So just reminding your echo participants that if you find this valuable, please tell somebody that you work with that you think could come in and join us, because we can send out as many mass emails and flyers as we want to, but people get inundated in their inboxes. It's often a personal touch to get people with those personal connections to say, I really think you or somebody in your office or somebody that you work with would really benefit from this information.
Yeah, super. Well, thank you. All right, thank you for those answers very much. And I'm only being brief because we're at 1 o'clock. Thank you so much to our 3 guests today. Dr. Mark Passanen, Dr. Sally Kraft, and Kelly Barnes. Thank you. As I said, I've learned a ton. One announcement, please mark your calendars. Our next seminar is Friday, May 31st from 12 to 1. It's entitled AIs that Predict, Discuss, or Intervene in Health Outcomes. Yes, AI is more than Arnold Schwarzenegger and Skynet. Find out more on May 31st. Thank you very much, everyone, for coming. Thank you for your discussion, and have a great weekend.
Thank